I went in about 8:30 that morning. I think surgery was around 10, 11 o'clock. I lasted about an hour. I got through recovery. I don't think I was in recovery too terribly long. Had some ice chips and woke up a little better. And when I was ready to get up and go to the bathroom, I got up and got dressed and took my walker and walked out of the room, walked down the hall, into the bathroom, and pretty amazed at myself. There was no pain. There hasn't been any pain since before the surgery. It's pretty exciting.
The outpatient total joint replacement procedure allows a patient to come in, have their hip or their knee replaced, and then go home later that very same day. They often spend only a couple of hours in the recovery room. They might be in the surgery center for 4, 5, 6 hours maximum.
I was told that this was an outpatient process. I think it was around 10:30. I was on crutches and moving about. Things went well. I was really quite impressed, to be honest.
Working at the outpatient center in some ways has brought the fun back into orthopedic surgery. The physician has control over the whole process. The physician has input into every step of the care pathway. The outpatient surgery center is a super clean, super efficient, very low infection rate center. My patients have been extremely satisfied with having their hip or their knee replaced as an outpatient compared to inpatient surgery.
My outpatient recovery was very nice. I was able to go in early in the morning, I was home by the afternoon, and I could walk and get around. And I liked being home the same day as I had the surgery.
The surgical center was a great opportunity. From the minute I got in there till the minute I left, it was my day. And everybody that I dealt with was there for me, and there was no doubt about it. They weren't preoccupied with anything else. You lose your anxieties when people are just about you.
I also performed the Mako robotically assisted partial knee replacement procedure. I was one of the first 2 doctors in the region to perform that procedure, and I performed a number of those over the past 2 years. For the out-of-town patient, we've set up a program whereby they can stay at a local hotel, and we can have a nurse visit them the night of surgery and the next day as well before they would go home.
Well, my overall experience with Dr. Scott's been very good. It's been 2 months since my surgery, and I walk at least 5 miles every day.
The home process, the outpatient process, I felt it was by far the better way to go. In a previous hip surgery, which was done 3 months earlier, that was done through a hospital. And that process also went well, but in comparison of the two, the outpatient process, for me, by far the better way to go.
Looking forward to being able to pick up my grandson and run around in the grass with him and go fishing with my husband again. And that first weekend at home, I bawled every time I thought about it because I didn't hurt. And I have not hurt for so long. There's a part of me that wishes I had done this years ago and hadn't waited so long. If I had, I wouldn't have had the experience with Dr. Scott and the one day in and out opportunity that I had. So I'm grateful. This is the guy you'd want doing your job.
Hip and knee replacement surgery has always been a very successful and gratifying operation. The patients generally do very well and are very happy patients. But this outpatient joint replacement process has overwhelmed my expectations. The patients are recovering so quickly and are so happy. It's been truly very gratifying.